Hello everyone, welcome to the episode 15 of Eureka Simply Wellness. Today's topic is about masks, which will be related and affect every Australians right now. Today's topic is about the acute and the chronic issues and illness that were related with mask wearing. But first of all, I'm not here to tell you not to wear a mask, but I'm just telling you the health risks that comes with it and how you can solve it and mildly prevent it. The people who will be mostly affected under the high risk area will be people who's obese, already have lung conditions such as asthma, hay fever, people who have deformed chest cavity and which will cause to poor lung, or people who naturally has poor lung, and especially smokers. And with the acute symptoms that you might feel with just 3-4 hours wearing a mask is dizziness, headaches, feeling a bit of woozy, and a bit of shortness of breath. That's because of lack of oxygen and increased carbon dioxide. And with the chronic syndromes, previously mentioned about high-risk area, you might be wondering what does obesity, diabetes, meat lovers, alcoholic has to do with the high-risk area, and what's that to do with masks, and I'll explain to you why. Because naturally, when we breathe, we need oxygen, and we breathe out carbon dioxide. And with a mask trapping you, you are inhaling back a lot of carbon dioxide back again with decreased oxygen, which will cause something called acidosis, which means your acidity level rises in both blood and kidney. And if you are smoker and alcoholic, diabetic, meat lovers, these are already high acidic intakes. And now with a higher acidity, you are furthering damage your lung and kidney. And with the Chinese medicine, lung is to do with our immunity and our skin health. So if you have poor lung, your immunity drops and your skin will have issues such as pimples, eczema, dermatitis. And with the kidney related to Chinese medicine, kidney is actually our life gate, which governs our teeth, our ear, our bones, and genitals. And so with the chronically, you might find you have some issues with acidic in the urinary bladders, and your hearing teeth becomes more sensitive to the cold, and your bone will suffer osteoporosis from lack of bone density from masks. And other health issues is by the manufacturing of the mask. For example, surgical masks. It's made of color dyes, chemicals, microfiber weaves. So when you inhale these color dyes and harsh chemicals, you are damaging your lung. And these fine microfiber weaves, when it gets to your lung, it clogs up your lung and later on artery, which you may lead to heart stroke. And another tip, high acidity means higher risk of cancer. Okay, and now the solution. There is a product on the market called face shield. Instead of wearing the mask on your ear loops, you can wear on your head, which oxygen can still get under it. So this way, you don't have to breathe in the microfiber, the color dyes, and harsh chemicals, and still be compliant legally. And another thing is scarves or products they make from cotton, polyester, or silk that you can wear on your neck and pull up as a mask. This way, it's safer for you and healthier for you, and without causing everyday disposable mask environmental pollutions to the sea. Diet-wise, you want to increase your alkaline level to counter the acidosis that caused by the masks. The food that is alkaline is all the greens, all the green vegetables. PHA waters, which you can buy from grocery stores. Apple cider vinegar, green tea, pu'er tea. And please share this video to the people you love, because everyone's wearing masks now. Everyone will have acute and chronic issues now or later. And I'll see you in episode 16.